most of you. She's from Aflac, so she's going to speak on behalf of their programs for a little bit here. And then all enrollees interested in obtaining Aflac coverage or making any changes, you can reach out to her directly during the open enrollment period, which may overlap with the one that I'm specifically talking about, may be more determined to the week that she's going to be able to help you with those things. So she'll talk on that a little bit. And then once you have all of the guidance for how to enroll, you'll see there's a link and a QR code that'll be on our employee portal as well that takes you straight to our O'Brien Aflac landing page. And there you'll see all of the documents that she's talking about, all the brochures on all their offerings, and be able to contact her directly from there. So Shelley, take it away.
Thanks, Ellie. Sorry, little glitchy there. Welcome everyone. Thank you. I know it's hard at the end of the day to focus in, but I'll make this as painless as possible. I'm Shelley Behrman and I'm with Aflac. And Aflac is your voluntary insurance. It is your supplemental insurance that is different from your medical insurance. Aflac helps with expenses that your medical insurance doesn't cover. And I'm not going to go over all the benefits and all the plans. I'm just going to give you an overview because the landing page in your portal really is very inclusive and it has all the brochures. There are videos that you can watch. So it's much easier than listening to me ramble on. But I will let you know some of the things that you may want to think about when you're signing up for your benefits are short-term disability. And short-term disability is your paycheck protection. And that is if you're injured off the job or you have an illness and you can't work. Aflac will pay, it's about 80% of your pay rate. It's based on your age and your gross annual wage. So it's not a one size fits all. And I really recommend that you reach out to me if you're interested in a quote and we can look at benefits to fit within your budget. I'm not here to sell you insurance that you don't need. I'm just here to make sure that we fill those gaps. And a couple of the other plans that we have are accident insurance. If you ride motorcycles, snowboard, skateboard, surf, anything with a board, you may want to look into the accident plan. We also have a hospital plan. Those two really help cover out-of-pocket expenses that your medical insurance doesn't. And then we also have a cancer plan and a critical illness plan. And those are more of a catastrophic coverage. And the difference between the Aflac is if you do retire from O'Brien or leave O'Brien, you can keep your Aflac and just pay Aflac directly. And so that's great, especially since some of the plans have building benefits. So every year you have the plan, they increase in value. And then Aflac is also very centered on wellness. And I know that O'Brien is, really trying to, get folks involved in that preventative care and the wellness piece. A lot of the plans do include a wellness benefit. Once a year, if you go to the dentist, the doctor, the eye doctor, or if you have a COVID vaccination or a COVID test, Aflac will pay you $60 per year. So in essence, you're really, paying for a few months of your premium just without wellness benefit. So that is all. I really recommend if you have coverage with me already that you reach out, especially if you've had any change in your marital status, any new family members, that type of thing. We just want to make sure that you're getting all the benefits that are, coming to you and that you don't need to make any changes. So thanks you guys for including me in this meeting, and I will talk to you guys soon. Thanks.
No problem. Thanks, Shelley. And I think you mentioned earlier today, when you go to the QR code to the landing page, you'll also see your calendar. So you can actually schedule things with you right there. So that's really handy this year. Awesome. Thank you. Bye. Have a good night. All right, next I'd like to introduce Mandy and Brandon, also known as Brandy and Mandrin from M&G. They're our insurance brokerage firm. So we're rolling over our third year with them as partners, and it's been really great. And then once they're done with their portion, we'll talk a little bit about our healthy employee initiatives for 2022, and then wrap it up with Paul touching on 401k. So Brandy Mandarin, take it away.
Thank you, Ellie. We've been called a lot worse, so we'll take that. It's good to be here. Appreciate all the participation here. Like Ellie said, I think we're almost tripled the amount from this morning. So it looks the same as this morning, though. It's dark, and so thank you. We won't be too long. We'll review the benefits here. I am going to share a screen so we can go through this. And like Ellie said, please use the chat for questions or at the end. One of the things too, we are the benefit consultants for O'Brien. So we do try to compare benefit packages to make sure they're the most competitive and attractive for the employees. And so we do a market analysis with other carriers to see what's the best. And it's good to know that this year we're staying with the same carrier and the same benefits. But also, as we go through this, we just want to make you aware of certain resources and also pointers that you can use. We know it's not easy to navigate through benefits. It's one of the most difficult things, it seems to be in life, is to go through a benefit experience, especially when you have a condition. And so hopefully you'll find this helpful. All right, I'm going to share my screen here.
Hey, Brandon, as you've got just a second, maybe talk about your insurance plan for insurance brokers, because you guys, as I understand, have one of the highest rates because you use your insurance. Is that right?
Yeah, boy, that's a loaded question, Paul. First of all, we have some of the worst benefits you can have as benefit brokers because we feel like we should be punished to be able to experience it to the nth degree. So that's one. And then two, apparently we're not a good risk. We utilize claims, that type of thing. I will say though, this past year we did a little bit better and we actually got a fairly decent renewal, but it was after a lot of negotiating and pain. So, but we live it just like you do.
I guess I just want to second something that Ellie said, which is like, really try to understand the benefit packages. That they're very complex. I want people to ask questions because there's a whole lot there that we pay for, and I don't think we use it the way we could. So I encourage people to ask questions. There just aren't bad questions. It's a complicated plan.
It is. And even just navigating through, common sense benefits can be challenging. And so hopefully we can give you a few tips. So I like this slide because overall it shows you the whole spectrum of benefits that you have and the benefits that O'Brien is providing. This is a very high cost expense to the company. It's usually the second largest overhead cost to employers is employee benefits. And so here, starting with the medical, like I said, we are renewing with no plan changes. We are staying with Cigna. This is a huge thing in this year of 2021. It's been a brutal year when it comes to carriers and their renewals. They've been bigger than before in the past, I would say 5 to 6 years. COVID brought an element of no access in 2020, which lowered claims. And then in 2021, everybody went back, and it turns out that there are other conditions besides COVID. So they were diagnosed this year where they weren't last year. So claims kind of went through the roof. And so we've seen carriers issue big renewals. And so to keep the same benefits is pretty rare right now. We'll go through the health reimbursement arrangement, the HRA, because this really lowers your deductible. And then also no changes with the Cigna Dental, renewing as is. Also the same with the vision, renewing with no changes. And then finally, another employer paid product that we are giving, O'Brien's offering, is the $10,000 life. So going over a few of the key benefits in your package. The first is a reminder about the network. We are with the Cigna network. It's called an Open Access Plus. To remind you, it's the biggest network you can have in the Portland metropolitan area. It has all of the hospital systems, so Providence, Legacy, OHSU, Peace Health, Seventh-day Adventist. So there's not a hospital you can't use in the Portland area. And then, of course, it's got a huge base of physicians and clinics to your access. The deductible will read as $5,000 for an individual and $10,000 for a family. However, we have a reimbursement on the deductible. So the employee is only responsible for the first $1,000. After that, O'Brien is reimbursing an employee up to $4,000 of that deductible. This makes this very reasonable on your out-of-pocket expenses. So out-of-pocket max, which is also a way to say this is your worst case scenario. If you were diagnosed with a major condition and you're going to have claims up to $50,000, this is the line item that you would pay attention to. So you pay your $1,000, they reimburse $4,000. This $7,000 already includes the deductible amount. So really, in essence, after you've paid your $1,000 and they've reimbursed $4,000, you would only have a remaining $2,000 left to pay before everything was covered 100%. Then we go into your copays. So that was your deductible, your out-of-pocket max, now your copays. If you are going to a primary care physician, this is a $30 copay, and it's covered 100% after that. If you go to a specialist, which would be like a dermatologist, an oncologist, anything with a IST at the end of it almost, those are a $50 copay, covered 100% after that. One of the things that we should list in here that we don't is that preventive care, as a reminder, is covered 100%. There is no copay. So if you're going in for physicals, mammograms, well child care, even colonoscopies, all of these things are covered 100% as long as it's coded as preventive. So here comes a tip into the consumer experience benefits. If you go to a physician to have a physical, and in that visit, they say, hey, you need some refills. You say, yeah, I actually do. And they write a prescription. You just change that visit to a diagnostic visit and not a preventive. You're then going to have to make a copay, and it would not be covered 100%. So you need to make sure when you're setting your preventive care exams that you only have it as preventive care. Same with colonoscopies. For those that are at that age where you get the lovely experience of a colonoscopy, those are covered 100% as long as it's preventive. If it's changed to diagnostic, which really you don't have a lot of control of, you're asleep. And so that would then change to a co-insurance experience. The next thing is a telemedicine visit or virtual visit. This is a $15 copay. We encourage this. They can write prescriptions. It's a great way to go if it's not an emergency, if it's off hours or that type of thing. Cigna has some, it's on the app that you can use. Mandy will be going through that, but we encourage this as it's a lower copay. Urgent care, this is kind of a big one that we like to stress because it's just a lot less expensive for you. And it also just saves a lot of time. And there's a ton of urgent cares in the area that you have you have accessibility to, and they have hours that extend into the late night. Urgent care is covered at a $50 copay. A lot of the emergency room utilization we see could have been handled in urgent care. Now, of course, if anything's life-threatening, especially pertaining to a child, if it's serious, don't mess around, go to the emergency room. You are going to pay a $300 copay, and then it's going to cost you 20% after you've hit that deductible. So you would probably pay up to $1,000 for that ER visit. And then, of course, the reimbursement would come in. The average expense of an emergency room in the Portland area is about $1,500 to $2,000, not to mention the amount of time that you're going to spend in there. Hospital services, inpatient or outpatient, will be a coinsurance after you've met your deductible. So if you are admitted to the hospital, you're staying overnight, then you better plan on paying your deductible portion of the $1,000. Fortunately, we've got an HRA to help that would reimburse you, and then you're going to pay a coinsurance of the total amount, 20%, up to the out-of-pocket max. Same with outpatient. If it's in and out procedure in one day, plan on hitting the deductible and the coinsurance, possibly up to the out-of-pocket, depending on the procedure. Now to basic lab and x-ray. These are routine x-rays if you have a broken bone, blood draw that's not related to a preventive care. Those types of things are coinsurance. There is no deductible applied to this, so you just pay 20% of the total. If you're going to have advanced imaging, and this is going to be your higher cost, x-rays, so CAT scans, MRIs, those types of things are going to be subject to the deductible, and then you're going to pay 20%. So now comes in another tip on this, because we often get caught in this expense that is a surprise. If I am at Providence and I'm seeing my physician and he prescribes a MRI, what would probably happen is he's going to say, hey, good news, we've got a MRI right down the hallway. You can do it right there. Well, that sounds convenient. You go down there, you get the MRI, and then you get a bill for $2,000 that you're going to have to pay. The reason why is that any time that it's a provider system like a Providence or a Legacy or OHSU, it's going to be a high cost MRI. Now, there are other options that are independent of these providers, like a Quest or an Epic Imaging. Epic Imaging is probably the most ones that you can use in the area. Those are going to run you about $800 versus the $2,000. You don't have to use the MRI tied to the provider system. You have the right to go out and go to an independent one. Alternative care is a benefit that's often forgotten about, but boy, we really need during the last couple of years here that would make us feel a lot better. Chiropractic is a $50 copay, and you do have up to 12 visits. Acupuncture is a $50 copay. There is a $600 benefit max. And then a massage therapy, which is really nice. It's a $50 copay, but you can get massages covered under the insurance. And then prescriptions, it's a $10 for generic, a $40 for a preferred brand. These are ones that have been on the market for a while. And then a $60 for a non-preferred. These are the ones that we see on TV that are advertised. They're the high cost specialty prescriptions that could cost up to, we've seen a couple $100,000 a year. It's nice to know that our cost is about $60 on those. So that's the medical. Shifting to the vision, you have a exam and material benefit, and there is no copay to either one of those. You can go in for an annual exam with an optometrist or a vision clinic, and you pay nothing. For frames, you have up to $150 towards the frames, and you get this every year. And then for lenses, you also get $150 every year. So total of $300 that you can use for glasses. These are the costs for the medical and vision. We don't expect you to memorize this. This will be available to you to be able to review. I will tell you that O'Brien is generously staying at the 80% that they pay for employees for these benefits. You will see a little bit of an increase on your cost, but not significant. And again, just be able to retain the current benefits is huge. Mandy,
Okay. Yes, yes.
you thought I'd never stop talking. It's your turn.
I do have a little bit more to add. I think we had a few questions in the chat box, and I did answer, but I kind of wanted to make sure that we addressed it. And it was just the question, if you have coverage when you travel outside of Oregon, is that still happening?
That is a great question. And yes, you do. This is what's nice about this Cigna network. It is a national network that gives you accessibility to all the 50 states, really. And so you can go on their network, mycigna.com, put in the zip code where you will be, and it'll bring up the providers in that area.
And that is what's great about the mobile app, because they can identify your location from the app. And so if you're in California traveling and you want to find a preferred provider and you bring up your app, they'll access your location and you'll find surrounding providers that are close by. So that's great. And then there was another question about prescription. And I just want to say what the question is. And then when Brandon, when you get to the prescription slide, you can cover that piece. And basically, the question was, should I be getting the walk-in pharmacy or should I use mail order? So we'll make sure that we address that as we get to that slide.
Okay, sounds good.
If we're good for the moment, I think that we will go to the dental slide. Okay, so I'm going to cover the dental. As Brandon mentioned at the beginning, there are not changes to the dental benefits. And the good news, also the dental premiums are not changing. So that's great. Anytime that can happen. Like Brandon mentioned, it's been a rough year for a lot of our clients and a lot of costs have been increasing. So we're glad that we can see that on this. I'm just going to review the benefits just as a reminder to you. There's a deductible on this plan. It's $50 for an individual, and then it's up to $150 for a family. And that just means if you have 7 people enrolled on the plan and then you all have services that the deductible applies to, the max deductible you'll pay that calendar year is $150. So that's how that works. There's a benefit maximum per calendar year of $1,000, and that's to cover the dental services that you have in the upcoming calendar year. For preventive services, those are covered at 100%. So I always encourage everybody, you should have 2 of those every year, no matter what, because a lot of times they can identify other health issues through your preventive dental exams. And so it's really important to get those. For basic services, this is a really great plan. It's also covered at 100%, but it's after the deductible. So the deductible does not apply to preventive services, but it does apply to basic and major services. So that's just a reminder. And again, it's one time per calendar year that you would meet that deductible. Did the screen go away for anybody?
Sorry, my computer just reacted. Give me a second here and I'll
Was
fix
it something I said?
It was.
Okay.
My computer was
Okay.
offended.
Yeah, so I'll get back to the benefits in a second when he pulls that up. But I did want to bring up something that came up in the first meeting that's pretty important. And you do have a choice to see whatever dentist you want to see. So there are preferred Cigna dental providers that you can access through mycigna.com. You can look up a dentist that is preferred in the Cigna network. But you also have a choice to see a dentist. Maybe you've been seeing the same family dentist for 25 years and you really like that dentist and they're not in the network. That's great. That is fine. But I just want to give you a little heads up that when you do that, because there's no contracts in place with the dentist and with Cigna, there may be some balance billing. So if you go in for your preventive cleaning and you're saying, hey, that should be covered at 100%, but you have a $15 charge. The reason for that is because that they're not in the Cigna network. And so I just kind of wanted to explain why that would be if that's happened to you before. Again, I think dentists are pretty, personal. So I prefer to see my dentist. You can actually also sometimes negotiate with your dentist if you know your dentist. I've done that before where I've switched insurances and they weren't preferred in network. And then, I was like, would you be able to take what they pay as your payment? And they've done that before. So there's lots of things that you can do, but hey, the screen's back, you guys. So that's all I wanted to say about if you use preferred providers, you are going to not have the balance bill piece for the preventive and the basic services. And then I was just going to cover that the major services are covered at 50%. So, and again, the deductible would apply to major services. One more thing I want to mention, the standard plan that's in place from O'Brien. They provide this to their employees. It's a $10,000 life insurance AD&D policy, just because you're employed with O'Brien. So it's great to have that in place as well. And there's no changes on that plan either. Okay, so now I'm going to go through the HRA, which we did kind of mention. This is complicated, and we understand if you're thinking, why do you have this on top of another plan? This is confusing. We do not want to confuse you at all. We actually want you to use this and get reimbursed if you are owed the reimbursement. So as a reminder, you have a $5,000 individual deductible on your medical plan. So once you've paid $1,000 towards that deductible expense, anything that applies to the deductible after that, up to the $5,000, that can be reimbursed. And so we have a third-party administrator, Peak One, that is set up to actually help you with these reimbursements. So I kind of, on the screen here, I take you through step by step how that would look if you were to need to use the reimbursement. So the first step is you would receive a medical service that applied to your deductible. So again, if you went in for an office visit copay, you're just paying a dollar amount. It doesn't apply to the deductible. That does not require any reimbursement. I'm talking more like a hospital inpatient stay, or even a high cost imaging, like Brandon was talking about the MRI, anything that applies to your deductible. The second step is then you would obtain your EOB, which stands for explanation of benefits. And you can do that. They send them in the mail, or you can go to mycigna.com. And if you haven't registered there yet, I do encourage that you do that, because you can access all your explanation of benefits there. So then you take that explanation of benefit and you can either fax it, or you can log into the online portal for Peak One. Now, at the end of the week, Ellie's going to be sending out a lot of information to you guys. And this will also be included so that you have the Peak One sheet, so that you can access it at any time and you know how to log into the portal and create something if you need to do that. The next piece is you file your claim. You include a cover sheet and the EOB. So you can do it through the portal or you can fax it, and there's those two ways to do that. And then the last step is to get reimbursed by a check, and that happens by a check or direct deposit. Again, if you want a direct deposit, you are going to have to complete some additional paperwork through the portal. But I will say that generally speaking, it's a pretty quick turnaround for the reimbursement. I know that some of employees have used it and they've had feedback, and it does work. So this is a good time to remind you guys, hey, if you guys already had an expense earlier in this calendar year and you kind of forgot about it, you might be owed a reimbursement, and you still have time to do that and to submit a claim so that you can get reimbursed for that. The other thing I want to remind you is that you don't have to fully meet the whole deductible before you get reimbursement. So let's say you've met $2,000 of your individual deductible. Well, that means that you're responsible for the first $1,000, but the second $1,000 you can get reimbursed for and submit a claim. So I just kind of want to make that clear. I don't want anybody to get confused thinking, well, I haven't met my entire deductible, so I don't know what to do, or I can't get reimbursed. Yes, you can. The minute you get over $1,000, you can submit for reimbursement. So if you can go to the next screen, Brandon, we have an example here of a Cigna explanation of benefits. This is actually the last page of it. And the reason that I have highlighted that line there is because that's where I want you to remember that you need to check on your explanation of benefits, because that will show you that how much you've met for your individual deductible for the calendar year so far. Now, obviously, this claim, you've only met $100 of the in-network deductible. So this is not a claim that we would file for the HRA reimbursement. But I'm just trying to get you to recognize and understand where you would find the information so that you could submit a claim if you are indeed owed reimbursement. I know I'm kind of talking fast. Did I miss any questions in the chat? I'm getting really excited about the HRA, I think.
There are questions in the chat, and we can leave some to the end if you want, or whatever you
Okay.
prefer.
Okay, do you want, Brandon, should we just leave them to the end and just keep trucking? I'm going to take that as a yes.
Well, hold on. I wanted to, one thing on this, just on the EOB that we hit on the last meeting is if you have any services that are subject to deductible, a lot of times the provider is going to want a payment at the time of service, which is fine. You just want to make sure you're not paying the whole amount, because what happens is that provider needs to bill Cigna, which then Cigna will apply discounts that they've negotiated with these providers. So we want those to run through before you pay what you owe. And most providers have come around to this, but still I hear some that still are like, hey, you're going to owe this amount. And it could be a large sum, and you need to say, well, look, Cigna needs to apply the discounts and then I'll pay the balance. And then, yeah, we can handle these questions here at the end.
Great. All right, the next piece I'm going to talk about is this customized website that Cigna created for O'Brien. And again, when you get that fabulous email from Ellie this week, I think this link is going to be in it, and you guys are going to be really excited about it. So it is really a great link, and I encourage you guys, if you have dependents that maybe aren't able to be at the meeting and don't want to listen to the recording, this would be a great resource for them, because you can see that there's different items at the top that you have access to. So it will show you your current benefits and coverage. It'll show you your upcoming benefits and coverage. It'll show you resources and programs. And we're going to talk about some of the programs and resources in this meeting, but you'll have everything at your fingertips right here at this website. I do want to remind you that you can't make any elections at this website. You can't enroll someone or terminate someone. Everything that you do will go through the normal way that you do it through your portal that you use at O'Brien, and Ellie will kind of touch on that at the end. But this is just a great resource. And then also, if you look up at the top right-hand corner, there is a number that you can call for Spanish-speaking hotline. And that's really a nice resource too. If you or maybe a loved one needs to ask questions about the benefits and maybe they just don't quite understand how this works, that is a great resource. So hoping that when you get that link, you'll click right on it. Okay, I know we've been plugging this all day. This is a reminder that you should register at mycigna.com. I know a lot of you already have, and that's great. But if you haven't, please do, because there's excellent resources here. You can have your ID card and see it there. As you see in the green there down at the bottom, they're also reminding you that you can download the app, the MyCigna app. So really convenient to have your ID card on your phone. There's compare estimate tools there. I know Brandon was talking about MRIs earlier, and maybe you actually want to vet that out yourself and see where the lowest cost MRI, but would be, you can do that all online here at mycigna.com. Okay, so the next piece is just a reminder that you guys have virtual visits available to you, and they do virtual wellness screenings now also from MD Live. And so you would access MD Live through the MyCigna app or on your computer when you go to mycigna.com, and you can have a live screening with a doctor. What's really cool about the virtual visit, it is convenient. I do appreciate that piece of it, but it also is really flexible to where you could have a visit on a weekend. So maybe you're working all week, you don't feel like you have time, but maybe on a Saturday afternoon, you could call in for a visit. And so it is very, very flexible, which is great. And so just kind of wanted to remind you that this is available to you on your plan, and they even do wellness screenings now. Brandon, I'll let you talk for a second.
Just for a second. I'll let you have the mic back, Mandy. I know. All right. So I think we've mentioned this each year, but it's just a good reminder. GoodRx is a great app to download on your phone. This is one of those tips in this complicated process sometimes of finding what's most affordable. Sometimes the insurance is better on prescriptions. Sometimes it's not. It could be GoodRx. So what GoodRx does is the app will show you, if you put in your prescription, where to go within a certain mile radius, and it'll give you the lowest cost for that prescription. And test it out. Sometimes it does beat the insurance. What GoodRx produces is a discount card that you will show the pharmacist, and then they will apply that. One thing to be aware of, if you use GoodRx, it will not go towards your deductible. So if it ends up being $25 through GoodRx and through the insurance, it's $45. The $25 won't go towards your deductible, where the other $45 will. So that is the trade-off. But it's a great app because, one, it does show you not all prescriptions are charged the same. You know, Walgreens is always going to be higher because they have more middle people in the process of that prescription versus a Safeway or Fred Meyer. They cut out a lot of the middle costs, and so you could get it cheaper there as well. If you have a maintenance prescription and you want a 90-day supply, you can print off a form on mycigna.com that you can bring to your physician, who then can fill out that, and you can send it in, and it'll be mailed to your home, a 3-month supply. There is no cost advantage to this other than you can get all 3 months up at once. That is it, and back to you, Mandy.
Oh, good. I was excited to get back to me. So I want to talk more about virtual visits. I know it seems like I just talked about that, but the reason I like this slide is because not only can you have a preventive exam or just a regular doctor visit through the virtual app, but you can also see a licensed counselor or psychiatrist through this app. And the reason I bring this up is because it's been a rough 18 months. I feel like we could all agree on that. Things are changing all around us rapidly. Everything's different. And we're trying to manage that, manage our work, manage our life, manage our home, everything. And sometimes it's nice to talk to someone. So I just wanted to remind you that 24/7, 365 days or nights, includes weekends and holidays, by the way. You would be able to reach out and talk to someone. And if you need to talk to a counselor, I think this is a great way to do it. So I just wanted to remind you that's a benefit and it is available to you. Okay. The next one, also kind of along the same lines. There are great tools with Cigna for support for emotional well-being. This definitely acts like an employee assistance program that is just included in your benefits. And I know that sometimes it's the last place that you would think that you have access or somebody that you could talk to, but I hope that some of you learn about this benefit and can take advantage of it because it's free to you. So aside from the medical benefits where you can use a counselor that way, you through this program can have 3 face-to-face visits with a licensed mental health provider in this Cigna Employee Assistance Program network. So that's available to you. You can do a live chat. You can have unlimited telephone counseling and access to work-life resources. There's a lot of digital tools. I'm going to get into some of the wellness digital tools that are new, and I'm kind of excited about it. And then also you can have access to legal services like a 30-minute no-cost consultation if you have some issues going on that you need legal counsel for. Also, you have access to financial services and 30-minute complimentary phone consultation with these types of services. Identity theft is also a resource here. And then just if you need help at any time and you don't know who you're supposed to call, what you're going to do, there is actually an 800 number here, and then you would use your ID number on your ID card. and you can get help. So I want people to know that it's available. Again, I know when things are going down and you're like, oh, I don't know, I can't find any elder care for my parents that are aging and I need to do this, but I'm working. And these are the things that an EAP can help with. They really can help with kind of family life resource things that are going on. So wanted you to be aware of that. Okay, you guys, it's getting pretty exciting because we're almost done. I really want you to keep this in your mind. I want you to listen up really great. There's 2 new apps available through the digital tools at mycigna.com, and you can download them there. They're free for you. The first one is called Prevail, which is a therapeutics program designed by experienced healthcare providers to help employees take control of the stresses of everyday life. And I think we all could use help with the stresses of everyday life. So it's got interactive video lessons, one-on-one coaching. It can help with depression and anxiety. So I would encourage everybody, if they can, download the app. You have access to some really great tools here. The other resource that's available to you free through Cigna is Happify. And this is a self-directed program with activities, science-based games, and guided meditations, which I need more guided meditations, you guys, I really do. So these also are designed to help reduce stress and anxiety, and defeat the negative thoughts and boost overall health and performance. And I think everyone in the world could benefit from that. So if this is something that piques your interest or you kind of want to know more about it, go to mycigna.com. Again, when you get that link to the website that Cigna created, you should have the resources there as well to see these 2 things that hopefully are going to help us kind of navigate. We all could use more tools to try to navigate what we're doing here. So I think that is what I have today.
Yeah, thank you, Amy. I hope I have access to those tools. I need those,
Yes.
especially after this meeting. No, I'm just-
Those are,
Everybody downloaded it during the meeting.
Hey, so we do have some questions that I'll tackle here.
thank you.
Yeah, so the first one here, it says, can specialists, how do I know if a specialist is preventive? And the response is, if you're going to a specialist, it's not going to be preventive. It's going to be diagnostic. So you need to make sure you go to either a primary care physician or an internalist. Specialists are going to bill it as diagnostic. Are preventive exams based on a calendar year or a rolling year? Must wait 366 days before exam. That's a good question. Your policy is January 1st to December 31st. So it kind of ties, it's a 12-month calendar year. So if you got one in February of this year, you could get it in January of next year. If you got it in June of this year, you could get it in January of next year. What happens after you hit the 600 max on acupuncture? Anytime there's a benefit max, once that's hit, you will pay 100% of the costs of that service. Do any of these added services require a referral from medical doctors? That's a great question because it doesn't. You can self-refer to any of those services, including massage, chiropractic. You do not need a referral from any other doctor. I think we answered the mail order pharmacy. Vision exams, is there a maximum number of exams or eye doctor visits per year? For example, if you go in once for your eye exam, have to go back for other reason within the same 12 months. Yeah, so it's only one eye exam per year. If you have to go back within the same year, you're going to have to pay that full amount. If I pay $2,000 for an exam at Providence, does this amount count towards my deductible? Yes, it does. Anything that any service that's subject to deductible and you pay that amount, it is going towards your deductible regardless of where the service was handled. Do deductibles cross or are they separate?
Separate. So just as a reminder, there's in-network deductibles, the 5,000 for an individual, 10,000 for a family. That's doubled if you use non-network providers. Again, you have to work pretty hard with Cigna to go out of the network, but you can do it. So just as a reminder, those are separate deductibles.
And I'm going to answer that question a little bit differently too, just in case they're asking about an individual and family deductible.
Oh, yeah.
Once you've hit, if you have a household of 4 that are all on the plan, you only have to hit the 10,000 regardless of who's hitting that amount. So if an individual hits 5,000, another individual hits 5,000, it's 10,000, you've met the family deductible between those 2 people. Good input there, Ellie, on the webpage. Do our plan cover gym memberships? That's a great question. I do believe they have some discounts, Mandy. Do you know offhand?
I'm actually looking through some things right now, and I don't think I gotta research that. It's
Okay,
not
we
coming
will
up. It's not coming
back
up in
to you.
the deck that they give us, for all the benefits. So
Maybe put that in our file for negotiating next year.
There you go.
you need a wellness fund, it sounds like, because it sounds like your group is kind of wanting to concentrate on wellness. So that can definitely, Brandon loves to negotiate wellness, don't you, Brandon?
Oh, yes. It's one of my favorite things.
He loves getting money from the carriers.
Do we have any other questions that people want to ask? And while you're thinking about that as well, we may have a little bit of a quiz here that has an incentive. But any questions?
I want to make sure too that we've got all HRA questions covered. Does anybody have anything outstanding now that we've covered the explanation of how it works? Okay. Good.
All right, Mandy, do you want to give him the quiz? And the reward is a DoorDash gift card. Let's see who's been paying attention.
Okay, before I go into the quiz, I do want to let you know that if you do log into My Cigna, you can see some lifestyle management programs available, which would be weight management, quitting tobacco, or reducing stress. We kind of covered the reducing stress. So I'm seeing that those are available. I will keep digging into the research on the gyms, but so far I'm not seeing that. Okay, here's the question. Now that I've confused everyone.
And they can either use chat or just you want them to blurt it out?
Oh my goodness. Well, they're all on mute, so they probably should use chat. So pull the chat
Use
up.
chat.
you
All
guys.
right, I
mean,
got it. I will
let's
see.
get
who takes
serious.
it.
Let's get serious
Okay.
about it. Okay.
Okay.
My money is on Asia Edwards to win because she seems like she's very engaged. Good job, Asia.
Well, and she has been in the healthcare business, so she's got a leg up on everybody.
Peter, I like it. I like it a lot. She's actually paying attention. Okay. Hey, everybody else besides Asia, I'm really pulling. I'm sorry that they've singled her out as their favorite, but you're all my favorite. Okay. So this is for everybody. It's all inclusive. Okay. So here we go. If you could please type in the chat the 2 apps that are available through mycigna.com for wellness, stress relief. They're new this year. I talked about both of them. I hope you listened.
Oh, I got it. We've got Bradley. Whoa, Bradley was
Oh.
wrong. Bradley was wrong.
Oh,
Oh
It
no.
was Alex. Alex Noble got Happify and Prevail.
yeah. And Shao came in second with correct and timely. Good
I'm
job.
curious on Bradley's Lofty app. Which one's that?
Now I want that one, Bradley.
Yeah.
I want to know what Lofty is.
Brad,
So,
Bradley, that's funny.
Ellie, if you'll let me know Alex's email, or you can just put it in the chat there and I'll take it.
Absolutely.
That's it for us. And I know, Paul, you have some stuff regarding 401k.
Yeah, really quick. I mean, I guess I want to remind people, we made the switch to, to work with Brandon and Mandy because we knew they would bring us the best quality plan at the lowest rate. I mean, medical and dental insurance, especially medical, very complicated over the last 10 years. It's very expensive. As Brandon said, it's one of our most expensive things we have in overhead and as a cost. And building an HRA within a plan and trying to maintain a deductible has been, sort of a tricky thing for people, but it had significant savings associated with it, a couple $100,000 a year for O'Brien. So we do the dance and we work within this complicated system, but it allowed us to save quite a bit of money. And we took that money, and I feel like rates are really important because not only is it about what O'Brien pays, it's about what people pay for their spouses and their children on the plan. It's easy sometimes to go, oh, well, that's the rate, we'll just buy it. We negotiate it very heavily and spend a lot of time sort of fighting with the carriers to kind of get the best deal we can with the most benefit. But there's nothing like seeing a super high rate to cover your family. So we really work hard to keep that cost down too. When we saved that money, when we did that, I went to Keeley and said, hey, here's a way we can save some money, but we're going to take that money and we're going to pour it back into another benefit. Like, it's not about the company grabbing that money. It's about helping people have more of the things we want. And a big thing for us was a 401k match. And so we rolled that out when we rolled this in, and we've had good participation, but I want everyone to utilize that to the very maximum they can. Those documents are in the portal in the library. It's very simple. You can go on it. It doesn't have an open enrollment. You can go on anytime you want. And if you look on the portal, you'll see a change form, and you can change the percentage that you contribute, or you can do an amount per paycheck. And it's a little different. It's a little less automated. You just reach out to Ellie or I, and we can get you on the plan. The first 3% you contribute on the plan has 100% match on it, 100%. So your money's automatically doubling when you put that money in there for yourself, as well as you have the tax savings. The next 2%, when you go 4 or 5%, you're going to get a 50% match on that money. So if you want the maximum benefit, put 5% in, you'll end up with a 4% match, which is huge. And then sort of the rule of thumb I give people is give till it hurts and then back off just a little bit. But you want the most amount you can in your 401k plan. You'll see it grow real quickly. You have that big tax benefit of having it in that plan, and the balance will grow very, very quickly. If you're confused about what to put it in, there's some good written things. It's through the AGC, so there's very low fees on the plan. Way better than you would get in the marketplace. So you're not giving the money to a bunch of administrators. If you're confused about what to invest in, I'm not your investment broker. I can't help you with that. I can explain what some of the funds are, but I can't give you advice on how to invest. But here comes my advice on how to invest. There are some target funds in there, and they're just managed funds. There are people that sit around every day and go, wow, this, if you're retiring in 2050, we're going to put this percentage in this and that. It's this sort of a risk level. So I'd say if you're confused about the different funds, pick a target fund that aligns best with when you're going to want to retire, and it'll match the risk level that you would be comfortable with. But invest as much as you can. If you have questions, reach out. Ellie and I don't get a commission on that. It's a benefit for you. I'm happy when people take advantage of it because I want to see people be successful in their retirement after they've been successful in their careers. So reach out, we'll help you with that. But that's where the savings is going, and it's working out really, really well. So, and Brandon, Mandy, thank you. You guys have done a wonderful job for us, and looking forward to another good year.
Thank you. Appreciate it.
Paul. Thanks, Ellie.
Yeah, thank you all. And I just wanted to tack onto that, our 401k contributing list grew about fourfold this year. And so it was really exciting to see. And I'm one of them that came on with the match. And it's great to see that money grow and know that it's somewhere safe. So, and we had one last question about a roadmap for an HSA, a savings account, health savings account. We discussed that a little bit and weren't really able to really tie something down for this next year. That doesn't mean it won't happen at some point or even at any point. There's some administrative costs that come along with that. And we've had, between some of these other functions, in order to keep this package in place, have had some administrative costs this year. So, that's something we're still discussing. We hope to be able to add into, or an FSA, something along those lines for people.
Yep.
Awesome. And I just wanted to touch.
Sounds good.
Yeah, we do have some 2022 healthy employee initiatives that we're going to be introducing to everyone here in the next month or so. And we're really excited about that because, we've all been through a lot, and our employee icebergs have grown a lot under the surface over the last couple of years. So, we want to make sure that we're working together as a community at O'Brien and Open Concept to help keep each other well. And just to end us here, that wellness is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So there's lots of aspects here, and I'm really pleased to see how much, and if you're on MyCigna, you'll notice you're getting monthly, notes about vitamins. There's a lot better comprehensive approach from the medical community, your standard medical community for this general well-being. And I want people to realize that and take advantage of it and reach out if you have any questions. Mandy and Brandon are great about answering questions too. So if your question didn't get answered, please reach out afterwards and we'll make sure that you do. So thanks everybody for your time. We really appreciate it.
Thank you. And I'll be sending
Thank
the
you.
recording. So you'll have that.